Hi, thanks everyone for joining in. We're going to go ahead and get started probably in about 2 minutes or so. So in the meantime, go ahead and watch the slides as they're going through. There's some information about upcoming things, and we'll get started again in about 2 minutes. Thanks. We're going to go ahead and get started in another minute or so as we allow people to get connected. So, thanks. Thanks everyone for joining us in our session 5 of our Cybersecurity Collaborative. We've already gone through last year 4 sessions. Here we are at 5, and there's only one more after this. So hopefully it's been beneficial to everyone, been able to learn some stuff and help everyone along going through the SRA. And why don't we go to the next slide. Today for session 5, we've got a handful of objectives that Michael's going to be walking us through, completing sections 4, 5, and 6 of the SRA, talking about physical security, business associate agreements, and some backups and data recovery plans. You can go ahead to the next slide. As has been for this session, I'm Matt Sterling, and also with us is Michael Sangili from Health Choice Network. I'm from Alliance Chicago, and we'll be your proctors for this. You'll mostly hear from Michael today, as has been the case. Go ahead next. So as I mentioned, this is session 5. First session was really just a kickoff for everybody. Sessions 2, 3, and 4, we went through different sections. And then here in section 5, we'll go through a couple of sections and then do a little bit of a wrap up, so that next session that we'll talk about a little bit more at the end, we'll have an opportunity to close things out, share what everybody has been able to accomplish during this, and then we'll probably discuss kind of next steps as to how we might go from here. Next slide. Just calendar wise, you can see we had our first kickoff in August. Here we are in January, and our wrap up is going to be next month. You'll see it's basically a month and a week, about 5 weeks to give everybody just a little bit more time to get that wrap up done before we close out session 6 next month. So today with session 5, as we talked about, I can read through these, security and best practices, and the business associate agreements, also contingency planning, all these things Mike will be speaking about. Let's go to the next slide. Meeting logistics, as all the other meetings have been, just go ahead and remain muted. If you do have questions during the session that you want to have addressed, please go ahead and type them out, and we'll be taking care of those or responding to those towards the end of the session. You can also reach out to us. Our email addresses will be shown at the end as well. You can reach out to us directly that way as well. And thank you for participating. And with that, we'll go ahead and get started with our first question today, our first poll. Just wanted to check and see how many people had the opportunity to get through sections 3 and 4, which was kind of the homework from the last session. The session before, we were hoping people would get through 1 and 2, and then 3 and 4. So if you wouldn't mind just kind of clicking one of these guys, we'd appreciate it. Just so that we have a little bit of an idea of what kind of progress.
We'll leave it open for just a few more seconds. We're almost at about 50% of votes in. Let's go ahead and close the poll so you guys can see the results.
All right. Well, thanks everyone for being honest about what your progress has been. Our hope, of course, was as we were going along month to month that folks would be able to make some progress as we were going along. So hopefully here in this next 5 weeks, there might be some opportunity that you can kind of carve out to be able to sit down and work through some of these sections. Just so that at the end, you know, we do have some folks who have been able to work all the way through the whole thing. So, and with that, I will hand off to Michael, who will go through some of the additional materials here for section 5.
Thank you, Matt. I appreciate it. Everybody, just to kind of give you a quick reminder, as we go through these sections, kind of the strategy we use to complete this entire SRA is if it's your first time doing it, and I know there's a lot of things that are, a lot of questions that are not easy just to answer quickly, and you have to really do some digging to investigate and find out the correct answer to the question. What I recommend that what you do is go through the whole SRA process and answer all the questions quickly that you can, that you know off the top of your head, or that's just a quick question, or, you know, a quick meeting with your IT staff. And then the questions that require a deeper dive or require some sort of tools to be deployed or something, you can hit the flag question for later option. And then once you've completed all your main questions and gone through the SRA, then at the end, you can just tackle those flag the questions for later questions. So just to keep that in mind, so at least you can kind of progress through the SRA and then have some sort of SRA completed by the end of all these different seminars that we go through. So today we're going to discuss sections 5, 6, and 7, as well as the reporting feature at the end. We're actually going to complete the entire SRA today. This is the last portion of it. And then our next section, our next session, we're going to report back to our individual teams and let everybody know how the whole progress went. And, you know, everybody that completed it, you can report back to your teams and let them know that you were able to complete it. We'll also have some speakers on the next session who are going to discuss all these results. So on this section 5, we're going to be discussing the security and the practice. And when we refer to security, we're really talking about the physical security here and less on the technical side. Physical security is something a lot of people forget about. We always think about the technical pieces, you know, our firewalls, our antivirus systems, and we're always thinking about hackers and things like that. But something we all forget is that there's also physical security. So just this first question here, what physical protections do you have in place to manage facility security risk is the perfect opener, because it opens up your mind to realize it's not just physical, it's not just technical things. You got to worry about intruders, people coming into the office building who are prying around, maybe trying to plug in a USB drive somewhere that contains malware, which they physically need to walk in to plug it into a computer, or look around at computer screens to see if they can find any patient data or confidential information on somebody's screens. So when you're thinking physical security, think in that aspect. So you want things like keypads, locks to get into the buildings, biometric devices like a face recognition system to either get into a building or a computer, even the fingerprint to get into your computer or into a building, badge systems and security cameras. You should also have in your policies and procedures an access control policy and procedure, and this should be able to outline who gives access to where and how is access granted to individual persons in your organization. Certain areas of an office might be more confidential that should not allow anybody to just walk in. So there should be one person in your organization or maybe a committee of people who will be granting this access to different areas of your organization. Next slide, please. So next question, do you have a physical protection in place such as cable locks for portable laptops, screen filters for screen visibles in high traffic areas to manage electronic device security risk? Again, this is what we were speaking about. Something to think about is your screen. I walk into practices and I rarely see screen filters on screens when I can look around and I can see somebody using an EHR system, and then you're pulling up patients, or a doctor can be using an EHR system, or a nurse can be using an EHR system, even the front desk person. And if you walk by, you can look at their screen and see names. There's often a role that we will play as hackers, where part of our job is just to gather as much information by just simply walking through an office building, and you'd be very surprised at the amount of information we are able to gather just through walking by an office building. This could even be just picking up papers off of a printer that has been left there, or again, just looking at screens. So keep in mind, have your screen filters, cable locks in case anything is ever attempted to be stolen in your organization. If a laptop is stolen or a server that may contain patient information, there's cable locks out there that you can have to just have your server chained down to that one area or bolted into that one area in case of any theft ever occurs. Next slide, please. Do you have an authorized user who approves access levels within information systems and locations that use ePHI? So just like on the technical side, where we have access control for software and we give specific access to people to different softwares, you need to have this outlined in your policies and procedures for the physical side as well. So depending on your position or your role in your organization, should you have access to certain areas? So for instance, us and IT folks, we know only IT folks, and not all IT folks are allowed into the server room. Usually it's just a specific or a handful of IT folks that are allowed into a server room because there's lots of confidential or hardware in there that can contain ePHI or confidential information. So just make sure you have this outlined in your policies and procedures, and then there's a person who can grant this access and keep note of this access. Next slide, please. Do you have procedures for validating a third-party person's access to the facility based on their role or function? Okay, there should also be a procedure for third parties. We often contract people, especially in healthcare. We have lots of contractors coming out, people from other tech companies who are going to come into the building and maybe help you design a software or work on the software that you're using, radiology machines, dental machines. There's all kinds of people who come in and out as third-party contractors. So some best practices is give them temporary badges, give them sign-in sheets. Something that we typically do is a person, even is a third-party contractor, cannot just walk into our building. Even with a temporary badge, someone has to escort them through our building. So that's just a good best practice to do. Just make sure you escort third parties into your building or contractors into your buildings. There's something called tailgaters. This is actually something hackers may do, and this is a service that we have done for centers in the past, where we will literally just try to walk into your building. We will wear a suit and a tie with a briefcase and look like we are supposed to be there, and just try to walk into your building and see what areas of your building can we gain access to and what information can we gather, like I mentioned in the past. Hackers have even been known to go as far as dressing up as a UPS man or a Xerox person there to fix your printer, where they try to just walk into your building right by the front desk person and tell them, oh, I'm here to fix a printer. They walk by, and then at that point, they're walking around looking at screens, seeing if they could take a USB with malicious software to plug it into your device, or just look at what's on your screens, pick up papers from your printers. So you always have to be aware of tailgaters. This is the importance of physical security, where everybody should have a badge that walks in or should be escorted. So next slide, please. Do you have hardware, software, or other mechanisms that record and examine activity on information systems with access to ePHI? So this one's on the more technical side and less physical, but it just falls under the physical because it kind of goes hand in hand. But you want to have software that can also monitor who logs into where that has access to EPHI. So if someone who typically logs in from the office that has an account, a doctor that has an account from the office, and is all of a sudden accessing your EPHI from another country, that should raise a red flag, because you know the person's here in the office or the person's here in the United States. And if you see their account is logging in from another country, that should raise a red flag and alert someone so that you can do something about it. Also, you should be able to see if they make any changes to this PHI. So if a name is changed or record information is downloaded, that should also be a red flag for someone to be alerted and pay attention to that issue. So just make sure you have access management tools in place that can detect, rogue logins in your organization. Next slide, please. What requirements are in place for retention of audit reports? So their rule for HIPAA guidelines has always been 6 years of audit reports needs to be maintained. If you don't have 6 years of audit reports, just start gathering all the data you have now and maintain it for 6 years. Part of the SRA is just to show that you have that you're improving on your security within your practice. So if you don't have the 6 years at this moment, just begin saving all of this information so that next year when you do report on your SRA, you can now say you have 4 years instead of 3 years, and that shows that you're showing progress with this SRA. Next slide, please. Do you ensure devices which created, maintained, received, or transmitted EPHI are effectively sanitized when they are disposed of? So this is something we discuss often in healthcare and healthcare security specifically. Lots of times we upgrade devices, laptops, computers, servers, and we either donate them or we throw them away or whatever the case may be. And sometimes we may think it's safe just to hit delete on files, when that is actually not the case. It's very easy to recover files that were deleted in that manner. So especially if you have EPHI or have ever accessed EPHI on a device or server, you need to have it properly sanitized. Now, there's guidelines on the NIST SP 888, and it shows you their guidelines as far as how to properly sanitize healthcare devices or devices in general that should get rid of any information, especially EPHI. There's also third parties that specialize just in this. They will get your device, they will wipe it for you and provide you with a certificate that says this device was wiped per these guidelines. Depending on your industry, they'll state the guidelines, and it gives you a certificate to let you know that it was actually wiped and that you're safe. So either use the proper software yourself and follow the correct guidelines to wipe devices as you let them go, or sell them, or whatever you may do with the devices that are old, or use a third party to have these devices wiped. Next slide, please. Do you ensure access to EPHI is terminated when employment or other arrangements with workforce members ends? So as you have employees that come and go, of course, always have the access terminated immediately. That's something else we see quite often, that we run audits on accounts to see the last time an account was logged into, and sometimes we can see accounts are active, but no one was actually logged into that account in over a year. And once we reach out to the center and ask about these users, we find out these users have not worked in this place of office for a year. Well, that leaves you open to a vulnerability, because any hacker could come in and compromise that account and you may never know. So a best practice is just to disable the accounts right away. If you're using a third party for your account management, then send that account management an email or a ticket right away and let them know this user is no longer here and to terminate their account. This can also cause issues with possible disgruntled employees that leave the office. And if the account's not terminated, they can log in from home and cause harm from home with their account. So just always terminate accounts as soon as a workforce member leaves or is terminated, whatever the case may be. Next slide, please. All right, so this is the first question based off of our first section that we went over. Select one form of physical security. So we'll open up the polls. You can either choose firewall, antivirus, or camera system. So which one of those is a form of physical security? We'll give you about a minute to answer those.
Okay, so we're a little over the 50% of votes mark, so we can give it just a couple seconds before we go ahead and close it out.
All right. All right, let's go ahead and close it out. So it looks like 80% of you answered camera systems, and that is correct. Firewalls and antivirus is more of a technical control than a physical control. I can see how sometimes people can think firewall, but camera systems is typically will be your physical security. Let's go on to the next slide, which is going to be the next section. So now we're in section 6. We're going to cover security and business associates. I'm sure many of you are familiar with the BAAs, or business associate agreements, and these are essentially contracts that are signed with, contracts that are signed with third parties that have language in there that's stating how, it has language stating lots of things, but it mainly states how they should handle EPHI in your workplace, the level of access they'll be given. If they need changes within their access, they need to request it. It's basically a guideline of how they should act within your systems while contracted under your organization. So the first question is, how do you identify which business associates need access to create, receive, maintain, or transmit EPHI? So best practices always, and this is not even just with business associates, this is just in IT in general, IT security in general, always give the least privilege possible to conduct their tasks to avoid EPHI overexposure or just any exposure of excessive data that they should not see. So again, we always give the example of an accountant should only have access to those parts of the organization that they view financial data. They should not have any reason to see EPHI or IT files or whatever the case may be. They should just have enough access to just complete their role. Because if we've seen time and time again where an accountant may have, full access to an entire organization, and which is totally unnecessary. It may be easier just to hit the all access button and then just grant them full access so that they don't have to continuously request access, but this opens you up to major vulnerabilities. If that account is ever part of a phishing attack and they give up their username and password, now these hackers have the username and password to an account that has full access. So that's why you always want to use the least privilege practice to make sure accounts only have access to what they need access to. Next slide. How does your practice enforce or monitor access for each of these business associates? So you should have, especially for business associates, very strong monitoring. You should be auditing them often, seeing what they access, what access they have, or making sure their accounts are also, especially business associates, you should make sure their accounts are always immediately disabled as soon as their contract is up. A big portion of this is you hear it in the news a lot of times where data leaks occur, hacks occur, and it could be the cause of a third party. A third party had access to confidential information and they were hacked or they were not careful and their accounts get compromised. And now if you gave that account full access to your environment or more access than it needed, then those hackers now have access to all of that information. Sometimes these business associates may not be as careful as we are in our own workplace, in our own organization. So again, just give them the least privilege as possible and just constantly monitor their access for anything strange or out of the ordinary that may occur. Next slide, please. How do business associates communicate important changes in security practices, personnel, etc. to you? So any security related changes, any requests for access elevation should come through to your IT department. Your business associate should not be able to grant this access themselves or should not have full access to do anything they please, as we said previously. So just make sure this is all stated in a BAA when you're hiring a contractor, and just let them know if they ever need access to any other areas that they have to request it, and make sure that's stated in the BAA. Next question. And that's the end of that section. So we're going to go with this question. What privilege level should a business associate have? We'll give you a couple minutes to answer. Answer A is least privilege to the systems, and B, full privilege to the systems. So what privilege level should a business associate have?
Okay, the votes are coming in, and it seems like folks are paying attention. They're doing a great job listening to all the great stuff you guys are sharing today.
That's great. All right, about 73% have voted. So you know what, let's go ahead and open it up, Steph. All right, so it looks like the majority have already voted. So what privilege level should a business associate have? You all answered least privilege to systems, which is exactly what it should be. Again, don't give full privilege, even if it feels easier to do so. Just make sure you give them the least privilege as possible, and that will keep you safe. That will also keep them safe as well. So just make sure you just keep it to the least privilege as possible. So let's go on to the next slide. So now we're going to be talking about contingency planning in section 7. These sections had a lot of questions, so we wanted to highlight the more important ones. Sometimes they dive just a little deeper into each question, but we're going over just the more important questions and the higher view of it, so you can get an understanding. So contingency planning. So is your contingency plan documented? So part of contingency planning is unfortunately a very large document that contains many different areas. You could even have them separated. It's just all part of one large contingency plan. But you should have physical, technical, and administrative tasks as part of your contingency plan or backups. And your plan should outline various scenarios. So some of these scenarios can go everywhere from technical. Again, we always think about the technical side. What if we get breached? What if we get malware? And then we think about our contingency plan. But sometimes we have to remember, what if we're here in South Florida, well, I'm here in South Florida, and we get hurricanes here. So part of our contingency plan, we have hurricane planning in there. And what do we do in the case of a hurricane, and how do we react to these scenarios? So depending on your area, you may have floods, tornadoes, earthquakes, power outages. You know, there's many different types of contingency plans you should have, and you should build this based upon your specific situations. Next slide. So do you periodically update your contingency plan? Contingency plans should be updated often, not just in the face of a change. You should make some sort of committee, maybe an incident response team that reviews this contingency plan monthly or quarterly and makes any changes that you may think of. If something does change in your environment, you should definitely always update your contingency plan. If you add a new location to your practice, you have a new practice, update that on your contingency plan and how we would act in that situation. If that practice goes out and doesn't have internet, how are you going to respond to treating patients still without internet? So just make sure you update it often, and create a group. That's your best bet. Use an incident response plan and incident response team. I think we're going to talk about them in the next couple of slides, but make sure you have an incident response team who is in charge of this contingency plan. Next slide. How do you ensure that your contingency plan is effective and updated appropriately? Contingency plans are not just reviewed and just looked at. You should actually perform a test. So an incident response team, and this is part of the tip that we state at the bottom, you create an incident response team to cover these scenarios. So actually, I think he's on this call, but one of our health centers here in South Florida asked us to be on a call with them while they did their tabletop exercise with their incident response team. And they actually went over different scenarios and over Zoom, and we discussed different scenarios and what we would do in those situations. He had key stakeholders from every department partake in this meeting, and we discussed different scenarios and passed it around the table and see what each person would do in the scenario, and then filled out a brief questionnaire listing all the different scenarios and how people would react to them. And what this did is opened it up for lots of questions, lots of things that different departments didn't know how they would handle in certain scenarios. So that's part of your tabletop exercise, which also updates your contingency plan. After that meeting was completed, they were able to go into the contingency plan and update it with everything they learned in that meeting. So make sure you conduct tabletop exercises, make sure you have a incident response team, and you continuously at least set up quarterly meetings to conduct a tabletop exercise to go over all the scenarios in your contingency plan. Next slide, please. There we go. Have you considered what kind of emergencies could damage critical information systems or prevent access to EPHI within your practice? Again, this is where we talked about it's not just technical scenarios. You got to watch out for, natural disasters, hurricanes, floods, earthquakes, tornadoes, power outages. So something we've seen in the past is a power outage occurred and a center lost some data due to this power outage. One of their servers, I guess, got, caused issues from the power outages. And when they turned it back on, the data was lost. So thankfully, they had this in their contingency plan, and they knew immediately that they had a backup server stored in the warehouse. They went and grabbed the backup server and were able to bring everything back up online almost immediately because of this contingency plan. So just keep in mind natural disasters as part of your contingency plan and run over those scenarios. Also, bring your staff in on these plans. So we have hurricane drills in South Florida, and we will just send out a text message. We use a text messaging system to let everyone know that the office will be closed or that we're monitoring the hurricane, to let everybody know the status of it and what the status of the office is. So during our contingency planning testing, we would just send out a text message to everyone to make sure we have everybody's phone numbers up to date, make sure the text messaging system is working and making sure that everybody understands this whole process. So use your natural disasters and other scenarios, part of your contingency plan, and make sure you test them. Next slide, please. How does your practice prevent, detect, and respond to security incidents? So as part of your contingency plan, you should work with your incident response team to go over the different scenarios and document it within your security incident response plan. So again, like I was stating, it doesn't have to be so complex as far as your documentation. As this health center that we worked with here in South Florida, they sent out a questionnaire, and based off the way people answered the questionnaire, that's how they documented their incident response plan, their security incident response plan. And it was very simple. They just asked simple questions. If, just to give an example, if a piece of malware infects your environment, what's your first step? And if they stated, contact IT, press this number on the phone, and it reaches out to IT. So that right there is part of your incident response plan. You can update that in there that this department will do this action in that moment. And if that's already the case, then you may not need to update anything. So that's just the importance of your incident response team and your tabletop exercises. Next slide, please. Has your practice identified specific personnel as part of your incident response team? So again, as you're creating your incident response team, you want to select key stakeholders from each department. This shouldn't be just an IT task. This should be someone from each department, specifically actually a head from each department, and you should all meet together as part of your incident response team, and then go over these exercises. You should definitely have a technical or a few technical people in your team, as well as administrative folks on your team, so that everyone in this organization can relay this information back down to their staff from their department. So that this is how you can just spread this information and how everybody would react in these incident response teams. So just make sure you have technical people, administrative people, and the heads of at least a couple of departments that can share this information with everyone else. Next slide, please. Has your practice evaluated and determined which systems and EPHI are necessary for maintaining business as usual in the event of an emergency? So there's always key systems for your environment to keep it running. Sometimes we may not need this one specific laptop or this one specific desktop to keep it running. That may not be important, but that server in the back office that contains patient information, or that contains the software that your organization may be using if you're not operating out of the cloud yet, those are key items or key devices that you need to keep aware of when you're creating your contingency plan. So a good practice to do is, if you do asset management, which you should do asset management in your organization, you should have a section of your asset management catalog that specifically states all your critical devices that need to be up and running in case of any kind of bad things that may happen in the organization, any kind of scenarios, natural or technical disasters. And right away, those are your main items that you need to keep up and running. So again, it could be your server, it could be your routers that you keep internet coming into your building, your firewall that protects you. Those are your critical devices in your organization. Next slide, please. Do you have a plan for backing up and restoring critical data? As part of your incident response exercises, you should have a plan backing up, and actually use that as the time to talk about backups when you're looking over your incident response plan. Talk about backups and how often they are done. So when you're going over these tabletop exercises, and let's say you're covering a scenario of a server that got corrupted and had EPHI, at that point, you should say right there in that moment, what's our backup policies and procedures? What do we do? How often are we backing up our devices? That is the time to review backups. And not only do you review it, you should also run a test backup. Make sure your backups in that moment are actually backing up. We have seen in the past where people thought they did have backups, but they've never tested them. And when they went to go restore the data from the backups because of something bad that happened in the environment, some files that got corrupted, they realized the backups weren't backing up properly, or they were backing up, but not backing up the correct information, and they were not able to restore that information. So a good practice is actually to run a full scenario where you will restore a server. Take a server, one that's not critical, that's not going to cause any harm in your environment, but wipe that server, or make a scenario as if that server is no longer working, and then restore that server from your current backups to make sure if you restored everything in that moment, your organization can continue operating as usual. So again, just double check that your backups are running and that you're restoring all your critical data correctly. Next slide, please. So that's the end of that section. We'll have one quiz question for you guys. So that question is, what disaster should be included in your contingency plan? A hurricane, malware attack, power outage, or all of the above? So what disaster should be included as part of your contingency plan? A hurricane, a malware attack, a power outage, or all of the above? We'll give you a minute to answer these questions. All right, it looks like the majority of people have answered. So what disaster should be included as part of your contingency plan? And all of you have answered all of the above. That is absolutely the correct answer. I know we've been talking mainly about physical attacks in this specific seminar, in this specific webinar, but in your contingency plan, you should have technical, administrative, and physical disasters that should be documented in there. It's a contingency plan for all areas. So all of the above is the correct answer. Good job, everybody. So let's move on to the next slide. All right, so now we are actually finally done. I know we've been doing this for 5 months, I believe now, or 4 months. We actually completed every single section. We went over all the different sections. And if you were able to follow along and fill out at least some, oh, sorry, looks like I was muted. So, okay, looks like we have gone over all the different sections already. And if you were able to follow along and fill out every single section over these 4 or 5 months that we've worked on, and you click submit, you will see a report. It actually gives you a risk assessment report. So this risk assessment report is very handy. You can actually export this report to a PDF. It looks different from what you see here on the screen, and it puts it in a way where you can kind of present it to your board, or you can present it in any meeting. It makes it really easy to read. So on this first part of your risk assessment summary, it'll show you your risk score. It'll show you based off the section. So if you see in the screenshot, you can see SRA basics. And that risk score there is an 11%, and that's based off how many vulnerabilities you may have, or maybe even questions that you hit flag for later. So if you see here in our section 4 that we entered in our test SRA summary, is gave it a 60%. So you would probably want to go and tackle those first, open it up, and see if why your area is so weak in that regard. So next slide, I think we're going to see a few more reports. Yes. So here it actually breaks it down. When you click on the left-hand side, you can click risk report. That first one was just an overall summary. This one is a risk report where you can actually see your critical vulnerabilities or your critical areas of weakness, you can scroll down here and you'll see each different section. It expands and collapses. You can expand the different sections and see where your critical vulnerabilities are. More of a tip, I guess you can say, is tackle your critical vulnerabilities first. Those are obviously your most dangerous vulnerabilities. So if you do have any critical ones in your environment, make sure you at least take care of those first. And by next year, when you come up again and you do your SRA, you may no longer have any critical vulnerabilities or maybe even mediums and be left with the lows. And that shows great progress on your SRA. So try to at least tackle your critical vulnerabilities immediately or as fast as possible. Next slide. All right, so I'm going to pass it on to Matt now. He's going to talk about more of our next sessions and where we're going to go on from here.
Yeah, we'll just kind of close things out for today. Michael, there was one question. I don't know if you had a chance to read through it. So why don't you read through that while I talk through this, and then we'll address the question. Just as far as preparation for the next session, which is going to be next month, as we talked about it, as we had mentioned, the idea for next session is a wrap up. So much like we did for the first session, where our executive team, the CEOs from both Alliance Chicago and Health Choice Network were in attendance on that first one and spoke. We're going to have them join us again here at the end of this whole collaborative to, again, reinforce the importance of this. And hopefully your leaders who are going to be invited to this are also going to participate and have an opportunity to hear even more and for us to reinforce the importance of this. So if you could go to the next slide. We're going to talk a little bit about interpreting your results and talk a little bit too about maybe a little bit more about reporting. We covered reporting today. And we'll talk a little bit more about stronger security practices. So again, what are we going to do as we get into maybe another collaborative? We have discussed doing this same collaborative again for those who were unable to join or people who joined in the middle so that they could see the beginning part. And then we have talked about this is kind of the 101 session. We talked about a 201 session. So we have not built out the curriculum for that quite yet, but that is something that we've discussed. So as we work with the different teams from the P-TECH team and the Q-TECH team from our respective organizations, we're really looking to see some progress on that security question about how whether or not you've done the SRA. So hopefully everybody who is here in these sessions have not had a chance to get through all of the sections, that between now and when we meet again in February, we'll have an opportunity to share that has been completed. And certainly between now and then, if there are any questions or anything, maybe if you can go to the next slide, you can certainly reach out directly to myself or to Michael at securityteam@alliancechicago.org or securityteam@hcnnetwork.org, and we'll be happy to help you with your SRA. So I'll take a quick crack at the question because I think it plays in a little bit to why, why would health centers do this, or why, where is the responsibility when in some respects a lot of the electronic, PHI is in a hosted environment and secured in that way. So the perspective that we would have is, it's really important that every organization, every health center go through the entire process of the SRA, because a lot of the SRA, as we saw in there are business associate agreements where the agreement is with the health center. There are user training, which is the health center has total control over. There's, at least in the case of how Alliance Chicago hosts the application, all of the users are created and removed and disabled by the health centers. That's the responsibility of the health center. So when you do talk about some of the physical securities, what you want to do is think about it from the perspective of your users may print something out, that EPHI, they may put it on a piece of paper and then put it somewhere. How is that secured? And of course, by policy, you may say you're not supposed to do that, but then that's how you could answer the question. So when you're thinking about physical security, again, you may not have areas that you have to worry about that as much as you might if you were hosting your servers and securing them in that way. But you do still need to go through the exercise, go through the SRA questions, and then answer them, from that perspective. There is a place, I believe, in the tool to put notes. So you don't have to, you can actually put what your perspective is in those notes and say, our answer is this, and here's the reason why. And then that way, if there are any questions about how that's being answered and the reason why, you can have some of those notes in there. So, Michael, other things to add?
Yeah, no, you covered it. That's exactly how you should review it. It's also good to just understand it in general. So review those questions, use that details section, which is where you throw your notes in. And if you're unsure, just ask. Sometimes, I know at least what we do is we send out our SRA for questions that we know would pertain to the centers. So I know some organizations do that. So any of the questions that I know the centers are probably going to need to rely on us to ask, we just send them out preemptively once a year. But if not, just ask. Usually that's a very common occurrence for them. We get asked all the time to answer some questions or help with some questions that they may not understand. So yeah, just look out for either an email from them or send them an email, and I'm sure they can answer those questions for you. But yeah, you covered it, Matt.
Cool. Great. Well, I don't believe there were any other questions. So with that, we've
questions in the chat.
Okay, great. So with that, we've come to the end of today's session. If you could go back one slide, if you don't mind, Steph. Again, we hope to see everyone, or at least you to see us again next month, February 23rd. It'll be that same time frame, 11:30 Central, 12:30 Eastern. And where again we'll go ahead and do a wrap up. And again, if you do have any other questions and need to get a hold of us, security team at alliancechicago.org, security team at hcnnetwork.org, and we'll be happy to respond and provide you any support that you need. Thank you very much for participating today and joining us, and we look forward to seeing you next month.
Bye.